An update now on a story that we have covered extensively surrounding Texas Medicaid delays. Newly released documents show a stark warning from the feds. These delays and backlogs could cost the state federal funding. So let's bring in KXAN's Ryan Chandler, who has been covering this for several months. Detail that warning now that we got from the feds to the state.
So the federal government is essentially telling the state now that you've been out of compliance in administering Medicaid and SNAP benefits for so long that now if you don't get your act together, we're going to take away funding that you need to administer these programs. Just to give you an idea of what we're talking about here, federal law says that states, agencies have 45 days to administer or deal with Medicaid applications once they're submitted. 40% of Texas's applications are older than 45 days. So that's a violation of federal law that CMS is saying they need to correct. Then we talk about food and nutrition assistance through SNAP. 90,000 cases are backlogged, and the oldest case is from August of last year.
Wow.
So imagine you need assistance to feed your family and you've been waiting for almost a year to get that approved. These are the kind of issues we're talking about.
Okay, and just to give our viewers some context, you've been covering this since really last summer. KXAN has delved into these delays. Give us context surrounding that, what the impact has been, and what we're hearing.
So the federal government kind of put states in a difficult position when they allowed COVID requirements to expire. During the pandemic, the federal government told states that are administering Medicaid not to remove anybody from that program because during a pandemic, healthcare is pretty important and they wanted everybody to continue their coverage regardless of their status. After that rule expired, Texas had millions of cases that they now had to review to make sure that those people were still eligible, and they just didn't have the staff or the manpower or the resources in order to do that. So just last year, we saw almost 1.5 million people who were removed from Medicaid. At least 100,000 of those were by accident, by state error or a computer glitch. People who lost their health care by no fault of their own and then had to be reinstated. So this was a major issue coming off right of the COVID pandemic and is still impacting this, and it kind of snowballed the backlogs that we're seeing.
Okay, so we've heard from the feds. They have issued this stark warning. What happens next? How is the state responding, and what are their next steps?
So HHSC put in a response to USDA, which oversees the SNAP program, and said that we have a corrective action proposal for you, and if we can execute this, we can come into compliance by September 2025. So we're still talking about 1.5 years of a cleanup process here. And Lloyd Doggett, our local congressman, has really been spearheading the efforts to try and get the Biden administration to hold HHS accountable. He said, quote, "Texans will continue to suffer until we have competent state leadership that prioritizes those most in need. The loss of federal funding would be a direct result of Abbott's HHSC failures." So he's really pinning this not just on the agency, but on the governor's leadership and the legislature, because at the end of the day, if this means that HHSC needs more workers to deal with these backlogs, they're going to need more funding, and that will come from lawmakers.
All right, Ryan Chandler, thank you so much. And if you'd like to learn more, we have continuing coverage on our website, KXAN.com.